Really good updates in haematology session today. Really looking at some of the data about PI3 kinases and BTK inhibition in B-cell malignancies. And there's going to be a deep dive in there into mechanisms of action with a particular focus on PI3 kinase inhibitors and some of the mechanisms of potentially of escape, and also some of the mechanisms of some of the adverse events that have been seen. We're also going to look at both CLL and follicular lymphoma, looking to try and identify what we consider to be the high-risk features. And Dr Davies is going to give a session on TP53 mutations, and really looking at the techniques that we should use and the indications for using it. Should we be doing this at diagnosis and before every line of therapy, or are there particular occasions that we need to do this? And then that's followed by Pierluigi Zinzani, who's going to give a really very nice talk on follicular lymphoma and how now we're able to identify some of the high-risk features. So in follicular lymphoma, we've are moving away from clinical parameters such as the FLIPI score, and now we can identify high-risk patients based upon, for example, the M7 FLIPI, which is combining the FLIPI, the performance status and the mutation status of 7 genes, which can identify very high-risk patients, and is a much better discriminator than the FLIPI score on its own. How we are increasingly using PET scans to identify our high-risk and low-risk patients, and talk about some of the data that's come out recently that looks from patients who have had R-CHOP treatment as frontline for follicular lymphoma, and if you progress within 2 years after having had R-CHOP chemotherapy, we know that your overall survival is significantly impaired. However, those patients who have had a remission duration of at least 2 years after completion of R-CHOP chemotherapy, they have an excellent overall survival. In fact, their overall survival near mirrors that of the normal population. So new ways of looking at risk in follicular lymphoma and how we may potentially apply new therapies. And I hope we're going to have a really nice debate afterwards and a discussion about how we might sequence and how we might use these BCR receptor inhibitors to their optimal effectiveness in these malignancies.